Ethicon endosurgery intraluminal staplers are designed with Halsted's principles in mind. Adjustable height staples and controlled tissue compression is the result. The tissue compression scale, combined with tactile feedback during closure, assists surgeons in assessing the compressed tissue thickness. As the device is closed, tissue is approximated. The device accommodates a wide range of compressed tissue thickness, 1.0 to 2.5 millimeters. Other devices used fixed height staples that dictate the required level of tissue compression, 2.0 or 1.5 millimeters, and require multiple devices to do it. In other words, adjustable height staples allow the surgeon to compress tissue across a wide range of thicknesses, while fixed height staples require one specific closure point. Controlled tissue compression delivers surgeons the flexibility and control they need for each unique patient.